My name is John Parkinson, and I'm the senior editor for Contagion. Welcome to our series, One Big Question. And just as the name suggests, we ask one question to the medical community, and we get their feedback on an important infectious disease topic. In this episode of One Big Question, we ask, with regards to the recent CDC guidance on masks, how would you characterize the way it was rolled out, and what would you have liked to see more of it from that? As the world continues to open up and people are able to shed their masks, questions remain about the CDC's guidance on masks and their decision to abruptly change their guidance for those Americans who are fully vaccinated. Since the start of mask mandates nearly 15 months ago, Americans have been asked to wear masks everywhere publicly. The restrictions have loosened over the months, and in May, the U.S. Centers for Disease Control and Prevention decided to change their mask guidance for those people who had completed the COVID-19 vaccine. This abrupt decision without further guidance left many wondering why the quick about face and many questions about public scenarios, and left the decision on how to proceed with mask mandates to state governments and businesses. We asked a few providers their thoughts on the CDC's new guidance and if there's anything they would have liked to have seen from it. Check out our video to hear their insights.
Everybody was a little bit surprised, but I think to understand, the CDC's guidance, you have to understand that they have two different priorities coming at them simultaneously. One is a public health point of view, which is what do we need, what kind of guidance do we need to protect public health? And then second one really has to do with individuals. What is an individual guidance? So I think this is where we're seeing the clash of the two priorities and how one priority at the beginning was more important, and eventually as one priority waned, the other priority became more important. Well, I think initially the public health perspective was to have everybody wear a mask, understanding that probably very early on we knew that individuals who were fully vaccinated and 2 weeks out from their last vaccine probably didn't need to wear a mask. However, there was no way to sort of do that on a broad public health point of view. For example, how would you do that in a restaurant how would a restaurant know who had been vaccinated, who hadn't? So to make sure that everybody who wasn't vaccinated wore a mask to a restaurant, they made the public health decision to make everybody wear a mask. So to make sure that one group wore their mask. If you want to look at it that way, early on, when everybody couldn't get the vaccine, it was better to err on the side of making sure everybody wore a mask to protect, to protect those who weren't vaccinated from being infectious to others. I think the challenge has been when to take the mask mandate off, because you can make an argument that everyone should wear a mask to protect the people who have not been vaccinated. But I think what's happened now is, since everyone can get the vaccine for the most part above 12, the question is, should society mask just to protect the people who've refused now to get vaccinated, as opposed to people who couldn't get vaccinated? And I think that's where the CDC tipped the scale. When you go to, should we protect all the people who cannot be vaccinated, to should we protect all the people who don't want to get vaccinated, that's where I think we saw the abrupt flip of the switch. And I think that's what we learned. When the equation changes and the people we're protecting are people who are refusing to get vaccinated, then you're saying, well, why should we force everyone to wear a mask just so we can make sure the people who are refusing to get vaccinated are protected?
Characterize it as science-based and very community friendly on the positive side. We know that the risk of outdoor transmission in particular is very low, and we know that masks work, and we know that vaccination is extraordinarily effective. So I think it embraced all of those developments. And it also helped us feel like it's about time to get back to some semblance of normal life. Let's just call it the new normal. I think the challenge with the way it was done was the lack of preparation and the abrupt nature of the directive, which was really, if you're vaccinated, you don't need to wear masks, period. So with regard to the first point, no public health authorities that are regionally based or community based, to my knowledge, were aware that the change was coming, let alone people who are running large institutions, employers. Really, really big issue, right? Especially when you're thinking about whether you need to require masks in your business settings. Restaurant and bar owners, very big issues as well. Places of worship, right? All these places where, there was a lot of discussion about all these places throughout the pandemic, and all of a sudden, nobody knew it was coming, and there was no specific guidance in terms of not just the setting, but even indoor proximity. So I think that, and then the black and white nature of it, again, no subtleties to the guidance. That was a problem, particularly because we know that the data for immunocompromised people and their response for vaccine or to vaccine is really not robust. For other people, I think we feel pretty good, normal hosts. But for people who might have immunocompromised, and that's a potential lot of people, people were nervous about just sort of saying, okay, let's ditch the masks, period.
We want to be able to reward people for getting vaccinated, and we want people to, get together, do the things that we all did pre-pandemic, because, COVID is not the only risk. There's a risk of, social isolation, risk of, other things that have not been done by much of the population for a long period of time. But that being said, there are arenas where masking is quite important, and one of those arenas is healthcare. And I think one of the inherent problems in healthcare is we're at a state right now where we often don't know whether people have been vaccinated or have not been vaccinated. And because of that, there are complexities, around how, how care and interaction should be managed. While we know that the vaccines are, overwhelmingly safe, overwhelmingly highly effective, they're not 100%, and people can still develop COVID. And so there are certain instances, such as, healthcare environments, public transportation, where it is going to make sense to wear masks, because, the risk would be is obviously if you're around unvaccinated individuals, that, there's potentially sort of risk of development of COVID. So I think, overwhelmingly, I think the intention is quite good, right? And that's what we want, and that's where we want to go. And I think everyone is tired of kind of how long this has been. But that being said, is there have been some challenges that we faced, right? And in terms of how to try to communicate that to, my staff, our staff here, our staff at the hospitals, our staff and patients in healthcare, as well as, lots of different local, businesses and entities trying to do their best to try to interpret what all this means. So I don't think that, just from my perspective, right, I think the guidance, is good, right? It makes sense. But I do think that it unintentionally created confusion that we're still trying to work through. I know, like in my own state, prior to that guidance, just the week prior, our governor had issued metrics for when there would be unlifting of different restrictions. So when 55% of the population 16 and above has had a vaccine, and 2 weeks after, this is where we're going to go. So that went up to 60, 65, 70%. So at 70%, there was basically a unlifting of all restrictions. But clearly, that has changed. And I think that points to the fact that probably not everyone was in the loop in terms of what communication, what was going to be coming and what communication looked like.
As you have heard, providers talked about the responsibilities of the CDC for public health versus individual health. And while many agree there was an abruptness to the decision without discussion with local health departments and people seemingly caught off guard, The CDC has since offered more guidance on mask wearing. It remains to be seen if COVID-19 will become endemic and masks may be necessary again. But the federal and state governments, as well as the business community in every walk of life, will have benefited from the experience of having done so. This has been One Big Question. Thank you for joining us.